Bonnie Urbay. Welcome to the Contrary, a weekly discussion of news and social trends from diverse perspectives. We are privileged to have as our woman thought leader today, Dr. Leana Wen. You've been hearing a lot from her during the pandemic about health equity issues, which have been her theme for many years now. She has a new book out called Lifelines, A Doctor's Journey in the Fight for Public Health. Welcome, Dr. Wen. How are you?
Thank you very much, Bonnie. It's a pleasure to join you. Thank you for having me on.
Good to see you again. So tell me about the thesis of your book. What's it about?
Well, I initially wrote Lifelines. It didn't have the name Lifelines at the time. Actually, the initial name for the book was Public Health Saved Your Life Today. You just don't know it. Because the concept is that public health is something that works when, by definition, it's invisible, because we have prevented something from happening. The problem, though, is when something is invisible, it often becomes the first thing on the chopping block. And so there's no face of a person who could have gotten lead poisoned if not for the home remediation that was done, or the face of someone who could have been shot had it not been for the community violence prevention programs that were in place, or the educational opportunities that they had access to. And so Lifelines helps to illustrate this point. And my initial intention was to put the face on public health, which of course, in the time of COVID, we have really put the face on it in a different way. And so part of the book too is talking about my own life story, which in a way is also a story of public health and how public health is a safety net, a lifeline, if you will, for many.
Now, tell us about your life story, which is a very moving one. As a child, your parents and you from China, and you were panhandling at one point. Tell us about that.
Yeah, I mean, it was actually quite a difficult part of the book to write because, again, I think I had wanted to illustrate the work that we did in Baltimore in particular around reducing infant mortality and around the opioid epidemic, that the professional work is easier than writing the very personal story. But again, I thought that it was an important story to tell because my parents and I came from China. We immigrated to the US when I was 7 years old, just before I turned 8. And when we first came, we had only $40 to our name. My parents, despite working multiple jobs, we had a lot of trouble making ends meet. And we always were very close to getting evicted. And there were times when we were evicted and were experiencing homelessness. And I wanted to tell that story because there has been this pervasive narrative of immigrants and how we somehow are using the system to our advantage in some way. But I wanted to show how, look, my parents were, my father was an engineer in China. My mother was a professor. They came to the US and we were able to seek political asylum here. But in the meantime, we had a lot of trouble. My father was cleaning dishes in a restaurant. My mother was, while she was becoming a teacher here in the U.S., she was working in a hotel and working in a video store. I mean, they did all these things, but we still had trouble making our rent. And I wanted to illustrate the difficulties that immigrants go through, and also for us, those basic provisions, including healthcare, including public education, they weren't entitlements. That for us, it was what we needed in order to make our way here and in order to secure a better future for me and eventually for my little sister as well.
Now tell me, how were you able to get into and go to medical school?
I didn't know that it was something that I could do. I knew that it was my dream to become a doctor. When I was young, I had severe asthma, and I actually opened Lifelines with the story of how I watched a neighbor child die in front of me who also had a severe asthma attack. And I mean, as someone who had asthma, I knew that it was frightening. I knew that it could be life-threatening, but I always knew that there was treatment available. And to watch this child die in front of me because his grandmother was too afraid to call for help because the family was undocumented and they were afraid of what might happen if the immigration officials were notified. I mean, I could see from an early age that healthcare should be a fundamental human right, but is not regarded as such in our society. And I wanted to help change that. But when I entered college, I was actually too embarrassed to tell anyone that I wanted to be a doctor because I thought that nobody would believe me. I thought people would laugh and say, but who are you to think that you could do this? Because you see, I wasn't raised in a family where we knew anyone who was a doctor, as in, I mean, I knew my pediatrician, but I didn't have family friends who were doctors in the US. I didn't know how literally you would get there. And I attended a large public university where a lot of people had this dream to become a doctor. And I thought, who am I to compete with all these individuals? And so I started working in a lab. I was in a work-study program. And I had a professor, a mentor, Dr. Raymond Garcia, who would always ask me, what is it that you wanted to do? And I would tell him, I want to be a lab tech. Because I thought that that was something that was believable. I mean, I was working in a lab, and my parents had a friend whose daughter was a lab tech, and so I knew what path you would need to do, you would need to go to get there. And it actually took me years to tell Dr. Garcia that I wanted to be a doctor. And he immediately said, let me introduce you to my former students who are now in medical school, and they can help you. And if I didn't meet them, I wouldn't have learned about the unwritten rules of the road. Something as basic as taking a prep class before I took my MCATs, or making sure that I also did volunteer experience, not just in the community as I was doing, but specifically in the ER or in the hospital, because that's what medical schools were considering. And by the way, even after I had all that, I mean, I had pretty good test scores and grades, I remember going to my career counseling office, and they said to me, every year there are dozens, hundreds of students from our school who have similar grades and test scores as you. They apply to 41 medical schools and they don't get into any. I was so devastated at hearing this. And I told the story to Dr. Garcia, and Dr. Garcia said to me, in that case, you have to apply to 41 medical schools. And so I say this because I have been so fortunate over the course of my life to have extraordinary mentors who believed in me when I didn't believe in myself. And this is why I'm so drawn. I keep on coming back to academia because I want to be this kind of mentor to others too.
But why did he say you have to apply to 41? First of all, it's expensive to apply. A lot of low-income people are really hampered by sometimes it's $1,000 depending on the school or the university per application. So why did he say you had to do that, and how did it end up?
Well, he said 41 in response to this career counseling office that said to me, all these students apply to 40 medical schools and they don't get into any
40.
who have your, so he said, in that case, just apply to 41 medical schools. Well, I followed his advice. It was, by the way, unimaginable to me to think about going into the kind of debt that you needed to go into medicine. I mean, again coming from the background that we did when we didn't have a mortgage, right? I mean, we didn't own a house. And so the idea of taking out a loan in some cases for over $200,000 for medical school, it was just, that would have been a total non-starter. And so I decided to apply only to programs that offered full tuition and living expense. And again, my thought was, if I didn't get in, I couldn't just go to medical school. And at that time, I wasn't yet a U.S. citizen, and so couldn't qualify for a number of loan programs. And so again, I think circumstances intervened, but I also was lucky to have had this consistent mentorship. And by that point, I had met enough people who could tell me about how to navigate the medical school admissions process. And so I ended up in medical school at Washington University in St. Louis. And then I subsequently, I think in medical school, also realized that my passion was in public health and health policy, because I was seeing all these individuals, all these patients who were ill, not necessarily because of something that we could fix in the hospital, but who needed something else. As in, I talk in Lifelines, for example, about a patient who had a seizure for such a long time that he was in a coma. He was a young man who had little kids. And the reason he had this long seizure, he has a known seizure disorder. But in the days before the Affordable Care Act, he couldn't get health insurance. And he could therefore not afford his seizure medications. I mean, he was basically dying from something that was entirely preventable. And in this case, he died and left behind his little kids who will never know their father, not because the medicines didn't exist, but because he didn't have access to them in this country. And that's unjust, and is my passion to not only help my patients when they come to be clinically with what they need medically, but also to be able to advocate for them and to work in this broader way to impact their health too.
Now, how have you seen public health work well, and where has it worked poorly with the COVID pandemic?
Well, even before COVID, and actually most of Lifelines talks about my book or my experience leading Baltimore's health department. I talked, for example, about how our work to reduce opioids resulted in more than 3,000 lives being saved in a 3-year period, and how by working together with over 150 public and private partners, we were able to reduce infant mortality in our city by 38% in a 7-year period, and critically close the gap between Black and white infant mortality by over 50% in that time. And so I'm very proud of the work that we did. And I think that is in a way a counterpoint, right? That is the counterpoint of people who say, well, what does public health do? Well, we can show these tangible examples of how public health saves lives and changes lives and levels the playing field of inequality. When it comes to COVID specifically, public health in general has failed. I mean, COVID itself is a manifestation of the failures of public health. And I think the ultimate reason is that public health depends on public trust. And when public trust is broken, it's very hard to regain. Well, how is public health trust, or how is that trust fractured in the first place? In large part, it was because of lack of consistent communication, right? And when
politics.
Yeah, and when basic measures like mask wearing. I mean, a surgical mask is what healthcare professionals have been wearing for years. We've known about the importance of masking since the first pandemic, the 1919 major flu pandemic. I mean, how has that become such a polarizing issue? Or vaccines. We have requirements for childhood immunizations in all 50 states. Why is the COVID vaccine seen as something so different? And so I think, to your point, I think the fact that there have been many people who, for their own, in order to benefit themselves in some way, have sought to make public health a partisan issue is extremely concerning.
Okay, it's very concerning, but and you were certainly a big supporter of the Biden administration when it first started with when it first came in, and the changes in public health policy from the Trump administration to the Biden administration. How do you think now, many months into the pandemic and with the variants having shown up, how would you grade the Biden administration in its public health policies?
Yeah, it's an interesting question, and look, I'm gonna give you an answer to this, and I think it's one that maybe not everybody is going to agree with, but that's the way that things go. I would give the Biden administration an A for effort, but a B- in execution and delivery. And here's what I mean. There's no question that the Biden administration recognizes the importance of having scientists lead. There's no question that they have done incredible work and have put in amazing effort when it comes to ensuring that we have the adequate supply of the vaccines and working with local and state health officials to deliver the vaccines so that by April, by May, certainly, everybody who wanted access to the vaccine was able to access it. I mean, that's really incredible. And I also love that they have prioritized health equity, that equity is embedded as a metric, as an outcome in all their work. I mean, that's something we haven't seen in any administration before, and I think is certainly very important. Here's the problem, though. They have really suffered some issues with messaging and communication. I think the single biggest mistake that the Biden administration committed when it comes to the COVID-19 pandemic is back in May, when the CDC essentially said, hey, vaccinated people don't need to wear masks. But since we don't have any kind of proof of vaccination system, that resulted in everyone understanding it as, well, mask mandates can no longer apply. At that time, less than 40% of Americans were fully vaccinated. It was way too soon to lift mask mandates. And as a result, that allowed the Delta variant to take hold in the US. We're now, at the time that we're speaking, facing more than 1,000 deaths per day. I mean, we're seeing the worst of the surge since compared to, except for the horrible winter surge. Right now, we're having 2.5 times the level of hospitalizations of the last Labor Day and nearly twice the number of deaths compared to last Labor Day. And we have life-saving vaccines. Then the Biden administration tried to walk this back, but it's too hard to put the toothpaste back in the tube. And I actually think that they're now embracing finally some type of vaccine requirement, but still no proof of vaccination. So in a way, I think it's a little bit too little, too late.
Now, do you think things are going to get worse? Are we going to have another surge like with the variants, the way we had with COVID-19, the Delta variant? Are there other variants coming along that will keep creating these kinds of public health and, one could say, economic disasters for the country?
I'm glad you emphasize that this is an economic issue as well, because sometimes we want to separate this and say, oh, this is just a health issue. But actually, this is preventing our kids from being back in school safely. This is preventing people from feeling safe at work. This is preventing people from traveling, from going to restaurants, from helping our economy to recover. And so it certainly is a whole of society problem. And that requires, first and foremost, a public health response. To your question about variants, we will have more variants. I mean, this is what viruses do. Viruses mutate. Now, the question isn't, are we going to have more variants? We definitely will have more variants. The question is three things. Well, we have a variant that's more contagious, more virulent, more deadly, and that may further evade the protection of our vaccines. The Delta variant is far more contagious. It's also more virulent. It does appear to work, or the vaccines that we have seem to work a little bit less well against the Delta variants, but it still seems to work against the Delta variant. Can we have something in the future that's all three, that may crowd out the Delta variant, that's even deadlier, and that may evade the protection of our vaccines? It's certainly possible. The best way for us to prevent from getting to that point is getting everybody vaccinated now. And our best hope for warding off another surge, especially come the winter, because this coronavirus is a winter respiratory virus, our best hope for doing that is definitely getting as many people vaccinated now as possible.
And what as a doctor, if you had a patient in your office who said, I'm not getting vaccinated, I don't believe in it, or I don't believe it's safe, or whatever reasons they come up with, what do you say to that patient?
On an individual level, whether we're talking to a patient or whether we're talking to a friend or a loved one, the answer is the same, or at least the approach is the same, which is that we have to approach people with compassion and not with judgment. We need to listen to them to figure out where they're coming from. And so, for example, if I just started talking to my patient and started saying, here's why it's safe and here's why it's effective, that's not going to connect if that person has a very specific concern. For example, somebody might think that the vaccine is going to give them coronavirus. Well, then we can explain this vaccine does not contain a live virus. That's not going to happen. Or if they have a concern about fertility, we can say, hey, here are all the studies that are done to show that it doesn't have an impact on fertility. And here's how this rumor got started. It was because of anti-vaccine activists who started this rumor. I mean, whatever people's concerns are, we need to understand what they are and then address them. And I think this leads to an important point, that the messenger often is as important as the message. That's a core tenet in public health. And in this sense, what I mean is that sometimes we may not be the most credible messengers to the people in our lives who may have concerns about the vaccine, but sometimes we might be. And actually, I would guarantee that for every one of your viewers out there, you are the most credible messenger to someone. And whether it's a cousin or a nephew or a coworker, there's something we can do to help to change people's minds.
How would you rate President Biden on his messaging?
I think the messaging has certainly gotten better. I was very concerned about what it was from back in May and the CDC's messaging, but also President Biden's messaging. I mean, 4th of July, President Biden had an event at the White House that was a big celebration event, supposed to celebrate freedom in part from the virus, but vaccinations were not required. President Biden was saying at that time, if you are vaccinated, you are protected, which is not true, was not true at the time, is not true now, and I think gave the false impression that if you're vaccinated, vaccinated, you should not care if others around you remain unvaccinated. That was a really dangerous message to have because it suggested that it doesn't matter what the rest of us do. It doesn't matter about all the unvaccinated when in fact it very much affects us. There are breakthrough infections. The more virus there is around us, the higher likelihood we have of having a breakthrough infection and so forth. And of course, there also are unvaccinated children. I have two little kids, ages 1 and 4. They should not have to pay the price for people deciding that they want to remain unvaccinated.
Well, that's another thing I wanted to ask you is you said to speak to people, the so-called anti-vaxxers, with compassion, but why should, when they get if they have not been vaccinated and they get the COVID-19 or the variant, why should the public pay for their health care? Why should, if they're on public, one of the Obama care plans, why should they have those costs covered when it was easily avoidable to begin with?
It's a good question. And I think there are a lot of people who are debating this from a policy perspective. I will say that from a clinical perspective, that's different. So a doctor treating a patient is very different from the government making policy for people. A doctor treating an individual patient, it is not our job to be judge and jury. We should not have to ever decide, are we going to treat this person or not treat this person? That's not what we do. I mean, somebody could come in who is a suspected terrorist or a murderer. We don't make the decision about whether they get care. We treat everybody depending on the conditions that they have and not on what they may or may not have done. That's a separate question from what happens on a policy level. There are debates going on.
Let me interrupt for a second because I read an instance of a man, I don't remember what state this was in, but he had heart problems and the hospitals nearby him were so overflowing with COVID
Alabama
patients. Right, and he died from heart disease that could easily have been, he could have gotten a stent or something could have been done in the hospital to save him, and he died.
Right.
Why should people like that die when the hospitals are at least partially filled by people who weren't vaccinated?
Right. I mean, that is a societal question, right? That is a policy question. And I'm not, I think this is horrible. I was just writing about this. In fact, that this is a 73-year-old gentleman who had a cardiac emergency. His home hospital called 43 other hospitals in 3 states and were unable to find him care. There was another instance of a man in his 40s, an Army veteran who served 2 tours in Afghanistan, who had gallstone pancreatitis. I've never seen anyone die from gallstone pancreatitis. Okay, this is a treatable condition. His doctor called around for 7 hours to see if they could find a bed for him somewhere. They couldn't. He died. I mean, it's not just care for COVID patients that's suffering. It's treatment for people coming in with all these other issues. Pediatric ICUs are getting filled. There are children who may not be able to get care because of the issues that are then dumped on them by adults because adults have not done their duties to get vaccinated. I mean, I very much take your point that this is something affecting individuals who are saying now, I think you're hearing it from a lot of vaccinated people who are fed up, who are saying, why am I bearing the responsibility and having the cost of somebody else's decision not to become vaccinated? That is absolutely a major problem. And I think we as a society have to wrestle with that. But I think that's also why, I've been very much in favor of vaccine mandates for exactly this reason, because this cannot just be seen as an individual decision to remain unvaccinated.
And finally, do you think that we'll get a COVID vaccine in a couple of years? It will be a matter of course to get a COVID vaccine along with your regular winter flu vaccine. Will it be there?
I think anyone who has tried to prognosticate this entire pandemic has generally learned that they would be wrong. And so I would hesitate to say what's going to happen in a couple of years' time, except to say that it is different from a static weather forecast, right? When you have a weather forecast, you're often wrong, but there's nothing you can really do about it. You're not going to change the direction of the hurricane. In this case, we can actually prevent that hurricane from striking us. And I think that's why it's been so difficult for us in public health to be watching all these events unfold, because they were and still are preventable.
Thank you so much, Dr. Leana Wen, public health expert and medical doctor, of course, and author of the new book, Lifelines, A Doctor's Journey in the Fight for Public Health. That's it for this edition. Please continue the conversation with us on Instagram, Facebook, and Twitter. Please go to our PBS webpage, which is www.tothecontrary.org. And whether you agree or think to the contrary, please join us next week.
Funding for To the Contrary provided by the E. Rhodes and Leona B. Carpenter Foundation, the Colcom Foundation, and the Charles A. Freoff Foundation. For a transcript or to see an online version of this episode of To the Contrary, please visit our PBS website at pbs.org/To the Contrary. Be more. PBS.